Welcome to our webinar, Strategies for Coding and Billing of Range of Motion and Muscle Strength. I am Dano Ybarra, President and CEO of JTech Medical, the premier provider of functional assessment equipment and extensive automated narrative reports. I'm excited to introduce today Lisa Maciejewski, CMC, CMOM, CMIS, CPCO, and president and owner of Gold Star Medical Business Services. Lisa's been involved in the medical administration field since 1982 and has an extensive knowledge of medical billing, medical office administration, and medical compliance. She and her husband launched Gold Star Medical in 2006 with a simple goal: medical billing for doctors who didn't want to deal with the hassles of filing insurance claims in-house. Lisa is a certified medical coder, medical office manager, and medical compliance officer. Her staff of billers, billing assistants, and consultants are simply the best in the industry, and she's very careful about who she recruits to join the Gold Star team. She travels teaching medical billing, coding, and administration classes for state and specialty medical associations, hospitals, and physicians groups. When she's not working, she spends time with her 6 grown children and 3 grandchildren, and is active in her church, is a certified yoga instructor, and is an avid sports mom. At this time, it is my pleasure to introduce to you Lisa. Lisa, the floor is yours.
Well, thank you so much for your kind words and for that lovely introduction. My name is Lisa Maciejewski, as mentioned, and I am the owner and founder of Gold Star Medical Business Services. And I have a short presentation for you today on the different strategies that you can employ in coding and billing for range of motion studies and muscle testing. So we're just going to get right into it. I'm not going to spend a lot of time on this, but I will certainly give you information on how to reach me if you would like more detail about these different strategies for coding and billing range of motion studies. There are literally 2 codes that you could use to bill for range of motion studies and muscle testing. The first one is the straight range of motion study CPT code 95851. Now, one of the things you need to understand about this particular code is that this code is only for range of motion studies. It does not include the muscle testing. So if you're doing both range of motion studies and muscle testing, this is not the code you would want to use. The other thing you need to remember about this code, as well as the next code that we're going to be looking at, is that these should be billed as a standalone visit. There are bundling considerations with both the 95851 code and the other CPT code we'll be discussing here in just a minute, in which if you bill these services alongside of an evaluation, like an exam, such as a 99203, or a physical therapy evaluation, such as a 97161, oftentimes this code will get bundled into that code and not get paid. Or you have to appeal it and send in medical records, and it could be problematic. So the recommendation is that you bill this as a standalone visit. This particular code is billed by the unit, not by time, and you can bill up to 7 different extremities that you are testing on one claim. So on the CMS 1500 form, the way you would bill it is as a single unit for each extremity tested, and for the first unit, you're going to bill the 95851, and then for every other extremity that you test, you would use the 59 modifier on the subsequent units. You would also need to make sure that you are pointing a diagnosis for each extremity to each unit that you are billing on the claim form. And remember that you have to justify medical necessity for these measurements in the patient's chart. You can't just bill 7 range of motion, extremities if you don't really have medical necessity for a particular extremity to be tested. And remember that the CPT code for range of motion studies do not include muscle testing. So on your claim form, this is what it would look like. And of course, most of us are going to bill this electronically, but this would be a visual of how to properly bill for and point the different diagnosis codes to the different extremity units. At this time, and of course, this is 2024, and I'm doing this presentation in the spring of 2024. The Medicare national payment rate for each unit of 95851 testing is about $22 a unit. It's going to be higher or lower depending on your geographical location that you're billing, but for the national average, it's averaging about $22 a unit. Now, the second strategy would be to bill your range of motion testing as part of a more comprehensive physical performance test and measurement visit. And this CPT code is 97750. So PPTMs, which are your physical performance test and measurement evaluations, also should be billed as a standalone visit after a patient has had an exam by a medical provider or a physical therapy evaluation or reevaluation by a PT. As with the other code, it should not be combined with other procedures because that will also result in bundling edits that you would need to appeal. Now, the difference between the 95851 code and this particular code is that this is a timed code, and it's billed by time in 15-minute increments. To bill 1 unit of this, the minimum time that you would need to spend on your measurements and your testing is 8 minutes. And on the CMS 1500 form, you're going to bill it as a single line item times the number of units in which you performed these tests. Also, you must justify medical necessity for the measurements in the patient's chart. And the best thing about this particular code is that if you're doing muscle testing, in addition to your range of motion testing, this will allow you to do both range of motion and muscle testing under the same code. And remember, you can do other types of physical performance tests and measurements besides just the muscle testing and the range of motion testing. There are other types of physical performance tests and measurements that you can be doing. Keep track of your time to determine the total number of units that you can bill. This is just a little chart that will help you calculate what they call the 8-minute rule for how to calculate the correct number of units to bill. And so you should be able to accurately justify the different number of units that you may be billing for. And on the claim form, the way it would be billed is the code on a single line with the number of units in box 24G. It shows, for example, this one is an example of billing 2 units of PPTMs, and the total charge is $100. So for each unit, the national average reimbursement in 2024 is about $34 a unit. So these are the 2 codes that you can bill for depending on the different scenario and the situation that you are trying to employ with your patient. So if you're just billing range of motion studies, the best code, of course, is the 95851. If you're billing range of motion and muscle testing, your better code is 97750. And this is pretty much of a side-by-side comparison on this particular slide of the different codes and the different strategies that you can employ. Well, thank you so much for your attendance today. I know this was a very short presentation, and I can give you a lot more information about documentation and other coding issues that you may come up against when you are billing these different types of range of motion and muscle testing codes to the different payers. I do hope you will reach out to us if you have additional information that you would like to know. This is my contact information. You can call our office and schedule a time to speak with me. You can email me, or you can use this little nifty self-serve scheduling tool for a free 30-minute consultation with me. Again, my name is Lisa Maciejewski-West. I'm the owner and founder of Gold Star Medical Business Services, and this has been your Coding Minute for range of motion and muscle testing.